Hi, I'm Dr. Hess and I'm an ophthalmologist. Today we'll discuss basic slit lamp techniques for examining the anterior segment or front part of the eye. There are 5 main steps to this technique, which progress from more anterior to more posterior and consist of examining the lids and lashes, conjunctiva and sclera, the cornea, followed by the anterior chamber, and finally the iris, pupil and lens. We'll touch on the slit lamp settings for each stage and end with some tips and tricks at the end. So let's get started. So first you want to examine the lids and lashes. Here use a diffuse light beam which is 8 to 10 millimeters high, 2 to 3 millimeters wide with 10-fold magnification and the grey light filter on. Angle the illumination column to about 30 degrees and then scan from side to side, looking at the medial canthus, upper and lower punctae, the eyelashes, lid margins and across to the lateral canthus. Common abnormalities here include things like blepharitis, chalazions and papillomas. You can also evert the eyelids here if it's indicated. Next, examine the conjunctiva and sclera. So use the same settings as step 1 and examine the bulbar conjunctiva and underlying sclera. Again, scan from side to side and look for abnormalities such as conjunctivitis, pterygiums and conjunctival nevi, and less common but important conditions such as episcleritis and scleritis. Now we'll examine the cornea. So turn the beam to 45 to 50 degrees to give you a better cross section. Scan from side to side and the cornea should be a clear window. So here we're looking for opacities such as infection or a corneal scar and defects on the corneal surface such as a corneal abrasion or a dendritic ulcer. You can use fluorescein staining at this point if it's indicated. Now we'll look at the anterior chamber. And we're looking for cells and flare in the anterior chamber. So you want what's called a conical beam, and this means reducing it to 1 millimeter by 1 millimeter, up the magnification to 16, change to the unfiltered setting and angle at 45 to 60 degrees with a pupil as a black background. Cells in the anterior chamber look like the particles of dust in a projector beam that you see in the movies. Flare in the anterior chamber looks milky or whitish grey. Cells and flare are seen in uveitis and some infections as well as eye trauma. High femurs and hypopions can also be seen and measured when you examine the AC. Finally, look at the iris, pupil and lens. So return to the same settings as step 3. Scan the iris for abnormalities such as posterior synechia or chorectopia, which is a displacement of the pupil from its normal position in the center. Now look at the lens, which should be transparent and colorless, but as we age, the lens takes on a yellowish tinge, which eventually becomes a cataract. So in summary, after you've prepared and positioned yourself and the patient, in order, you want to examine the lids and lashes, then the conjunctiva and sclera, then the cornea, followed by the anterior chamber, and finally the iris, pupil and lens. A couple of tips for practicing your slit lamp examination. Firstly, a common problem is patients being light sensitive. So to counter this, turn the room lights down, then reduce the light intensity of the slit lamp using the rheostat. You can also reduce the height and width of the beam and use the grey or neutral density filter on the illumination column. You can practice using the slit lamp by examining friends or colleagues. If you're on your own, you can actually examine the palm of your own hand, aiming to get a sharp view of your skin creases. You can also examine eye drop containers or other items which contain very small text or features and try to get a sharp view of these as well. Thanks for watching this video. For more eye videos, visit eyeballsmadeeasy.com, and if you have any questions, feel free to get in touch.